Since my diagnosis in March, I have found myself using a lot more of the tools that I have taught my clients and students to use. So I found myself really grasping for these tools that I've always taught others to use. So I think a lot of what my issues were prior to cancer, because I feel like it kind of defines a before and an after. So before my cancer, I was stuck with this, I just want to be happy. I think that was what was on my mind. And even more so now with the cancer diagnosis. I just want to be happy. That's what I just kept telling myself. When people would say, my close friends, what's the matter with you? Like, you don't seem like yourself. And I'm like, I just want to be happy. Well, what I'm going to tell you today, and what I've learned, that if we're not happy and we're not happy all the time, that something's wrong with us. So we strive for this definition of happy. And there's actually two different definitions of happy. The first one is it's a feeling, right? It refers to a feeling you get of pleasure and gladness and gratification and just this euphoria. That's a feeling. And that's what we seem to be chasing all the time, like a drug, right? We start to feel down and we're like, oh, I need to get back up there and feel happy. But the second definition of happy is basically living a rich, full, and meaningful life. We want to focus on what we can do. And we want to focus on that second definition of happiness, of living a rich, full, and meaningful life. With dealing with cancer, like we are, you can't control your feelings about cancer. I've had so many mixed emotions about it. And, things I don't like to hear is, well, everything happens for a reason, or, no, sometimes life just sucks. And I have to, that's okay. Feeling angry about cancer, feeling stressed that you can't do everything you used to be able to do, feeling overwhelmed with what was just normal a year ago is no longer normal for you. That's okay. There are no right or wrong emotions. There are actions we take to live the life we want, but we can't control those emotions. So when I was first diagnosed, my sister-in-law, who it's a very small town. She's a nurse practitioner. She said, let's get you a CT scan, because I was having a lot of stomach issues. And she's like, we got to figure out what's going on. And on my CT scan, my breasts are big enough that it filled part of the CT scan when they were looking for my stomach. And that's where we found some of the spots. And then I was told to go get a mammogram. So I had a lot of emotions with that. A lot of guilt myself for not taking it, not going right away and being more aggressive, and just what would have happened if I would have, been more aggressive and talked to people and went to the doctor earlier, and just feelings of even guilt that it was my fault that I'm stage 4 right off the bat. I didn't even catch any earlier warning signs. So that is why this acceptance commitment therapy is such a passion of mine and something I believe in so much, because I feel like I'm honored to all those feelings that my situation brought me. I'm a stranger to you, but if you told me the same story that I've been through, I would also tell you, hey, you have every right to feel that and be angry and mad and frustrated. So what acceptance commitment therapy does is kind of take these inner thoughts that you're having and not say that they're right or wrong or you need to change them, but to work on accepting those thoughts and then committing to doing things and changing some goals to live the life that you want to. So if we can't control how we feel, if we can't be happy 100% of the time, then what do we do? There is something that we have control over, and that is our actions. Acceptance is a really hard word. So I've had people say, well, are you telling me I should just accept that I have cancer? Acceptance, think of it as dropping the struggle with it, letting it be, making room for it. I had a little first grader last year that I think said it best. He said, I was really angry, but then I decided just to feel my feelings and move on. So acceptance isn't saying, oh, I've accepted I had cancer. There's nothing I can do about it. My life's over. That's not what it means. It's accepting that all these feelings that you're having with it are real and valid, and you're entitled to them. Because even painful moments, even painful thoughts and feelings can sometimes help us or point us towards things we need to address, problems that we are having, or things we need to do differently. I would say the biggest thing with me for my cancer is all those things that I was pushing away before that I thought I was struggling with or striving to have, like problems with my husband or friends or the job I didn't get that I wanted. When cancer came into focus, the good thing about that is my priorities really changed, right? I'm not saying that I would choose cancer again, but I am choosing to maybe think of it as it's pointing me in a different direction for my life than I would have had prior to it. So that's what acceptance means. We're not getting rid of it, right? We're not going to ever get rid of all these feelings, or there's some things we just can't change. But instead of forcing it away, which takes a lot of time and energy, we're going to learn to accept it and accept those feelings with it. My goal is for you to identify what is truly important and meaningful to you. And in acceptance, commitment, therapy, or ACT, we call that values. And then teach you mindfulness skills when you get hooked by these difficult thoughts and feelings to move more towards the things that you truly value. And what I want you to learn and really take away from tonight is life is difficult. And you throw in what we are dealing with, and it just makes everything that maybe even would be halfway tolerable, even that more difficult. And a human life comes with this whole full range of emotions. We have a lot more emotions than just happy. Emotions are both pleasant and plain, and your mind is wired to naturally try to increase your suffering. That's just how it's wired. And it all really centers around, what do you value? I will tell you, when you hear that you have cancer, when you hear that you have stage 4 cancer, I had a little flash picture that went in my head, and it was my kids. And I don't need to spend weeks with probably you guys asking you to figure out what you value. I'm sure that if there's one thing cancer has done, it has really put these things in the forefront of what you value and what's most important to you. So I think that's something that's probably a little bit different with this group. Mine was definitely my kids, and that's the picture I had. They just both turned 13 and 16, and will I be there for certain things, and how healthy will I be for certain things? When I got that news, this isn't me, but this picture, I stayed in bed for almost 3 days. That's how I was processing it. But finally, I had to think about what I value. And if my value was truly my kids and being there for them, then just staying in bed and wasn't getting me towards the things I wanted. Okay. In the short term, it was helping me to avoid what was going on. If you're sleeping, you don't always have to deal with things. So I had 3 long days of good sleep. And, but then I had to kind of make this choice. And this is what we call a choice point. So up here at the top of the arrow are those things, our values, those things that are most important to us. So I'm going to use my kids. And then each day, maybe even each hour, we have all these choices we have to make. And we can either move towards the things we value, or we make choices that hook us and move us away from it. So I realized that what I was doing was moving me away from the things that I value. So I had to make steps and plans to get back to what was really important to me. When you get hooked by these thoughts and feelings, then you're not being effective. In acceptance commitment therapy, we do not say bad feelings, bad thoughts, bad choices. We just say, are they moving you towards what you want or away from it? And that's what this choice point visual comes into. So what happens though when we get here and we get hooked? Because that is when all these thoughts come in our head. I'm not good enough. There's no sense in trying this. I just got a scan and it wasn't the results I wanted. How do we get unhooked? So the next part after identifying your values is to learn techniques to unhook you. And I know we didn't have very long today, but I wanted to go ahead and give you one that I like to use. And it's called dropping anchor. And this is a strategy. It's a multi-purpose mindfulness tool. Pretend that you're on this boat in the middle of the ocean. You can't see land anywhere. And this huge storm comes out of nowhere and you're stuck in it. And that's kind of how I describe cancer, right? You're just going along and then all of a sudden you're in this huge storm. The first thing that you're going to do in that situation is drop anchor, right? You're going to put your anchor down. That anchor is not going to stop the storm, right? You're not going to stop the cancer, but what it's going to stop, it's going to ground you, and it's going to help control you. It's going to hold you steady. But there's 3 steps to it. It's acknowledge your inner experience. So acknowledge these thoughts and things that are coming to your mind, then come back to your body and then engage with the world. First, take a moment to acknowledge that there are difficult thoughts and feelings showing up for you right now. And at the same time, if you're able, see if you can push your feet hard onto the floor. Push them down. That's it. And feel the ground beneath you. Now sit forward in your chair and straighten your back. Feel the chair beneath you and notice your back supporting you. Now slowly press your fingertips together. And as you do that, gently move your elbows and your shoulders. Feel your arms moving all the way from your fingers to your shoulder blades. Take a moment to acknowledge that you have a lot of pain that you're struggling with. You didn't ask for it, but here it is. And it's challenging and it's difficult and you want it to go away. And yet it's not going anywhere. Silently acknowledge to yourself what type of pain it is. For example, say to yourself, here's sadness, or here's anxiety, or here's a painful memory. Now notice that there are painful thoughts and feelings here. And there's also a body around all that pain, holding it, containing it. And it's a body that you can move and control. Straighten your back again and notice your whole body now, your hands, feet, arms, legs. Gently move them and feel them moving. Have a good stretch. Notice your muscles stretching. Press your feet down and feel the floor. Now open your eyes and look around the room, up and down, side to side, and notice 5 things that you can see. Try to notice 2 or 3 things you can hear. The sounds coming from me or something in the room around you. So notice there are some difficult thoughts and feelings that you're struggling with. And at the same time, see if you can also notice your body in the chair and gently move that body. Have a stretch. Take control of your arms and legs. And also notice the room around you. We can't control our thoughts, but we can control our body. And then that will help us get rid of those thoughts that are hooking us. And kind of help us feel like we're back in control. I know I did that also at my last MRI, just feeling things, hearing things, and it really helped me get through that procedure.